regarding hospitalizations as well as transfusions ties in very well with where CMS is headed with the QIP. They are looking at these elements, these new measures, in the next 12 to 24 months. They are part of the QIP for 2017, 2018, and specifically looking at hospitalizations, readmissions hospitalizations, transfusion rates. Certainly they're interested in expanding vascular access. There's some strong interest by CMS to expand that criteria to grafts as well. In other words, they're looking at the idea of allowing you to include grafts along with fistulas within the QIP to show that you're staying away from catheters. So I think that's certainly a good sign. I think the data that was presented today was very interesting. But clearly, what DOPS is looking at, I think, is exactly in the same direction that CMS is probing and trying to get information from facilities. So I think it's spot on. I had a few other slides. We don't need to necessarily go through them, but I was certainly going to talk a little bit about 5-star. Many of you folks are familiar with 5-star and those issues. We can stop right there for a second. There was just a technical expert panel that met last week to talk about some of the concerns about this. There were members from the ESRD community as well as some statisticians that were brought on. And the concern has been about how patients are using this information. And the concern, of course, about this bell-shaped curve. Our cover story in May addresses some of this. There was a second report that came out by the Kidney Care Alliance that also looked at the star ratings and where they were geographically around the country. And there's some real concern about that because it would appear that in areas where you have the most difficult patients are the areas, in fact, where you're getting low stars. So are you providing good quality care, or are you being, in essence, penalized by the fact that you have more difficult patients? The 5-star rating system does not adjust for that, and so that's a real concern. CMS has placed a disclaimer on the Dialysis Facility Compare website telling patients that it's not the only element you should look for when you look at clinics and you try to determine quality. But it still has a certain implications. I think that's a big concern. I just gave a talk this past week in Colorado. Many of the folks had not even gone to Dialysis Facility to Compare to look at their star rating. I do urge everybody to do that. While we may see some progress in how it's implemented in the future, I think everybody should know where they stand because more than likely patients will be involved and they will be interested in doing that. Next slide. The ACOs are supposed to launch next month. We're looking forward to that. There's been a number of delays. Here's some key points about what they're about. And we'll see the LDOs launch in July. A couple months later, we expect the smaller providers to do so as well. Next slide. Again, some more information about it, what they're about. In essence, CMS is looking for a new payment model, is what ACOs are really all about. And we think we'll find out in this 5-year demonstration if the ESRD community is a good fit for that. Next slide. Okay. Some other quick points, the bundling payment, no expected changes for 2016. The ICD-10 payment codes will be changing in October. Everybody, all the practice groups should be ready for that. The sustainable growth rate, which influenced physician payment, is now dead and gone. Will be replaced by a new performance model. We're not sure about the details, but we'll find those out, I'm sure, in the next year or so. Still trying to get lifetime immunosuppressive drug coverage. And there are some changes going on with the conditions of coverage. CMS has been gathering data from facilities and providers to get some ideas on what that should look like. Next slide. And that's it. Some information on how to get access to our website and certainly our publication for a lot of the information I just mentioned. Here's some resources for you. And, of course, if you need to contact me, please do. Thanks, Bruce.
Mark, thanks so much. Yeah, and for the audience, of course, Mark's website is really just a fantastic resource for up-to-date information on relevant policy and issues of importance to the community. We are just 5 minutes past the top of the hour, so I think we'll call the WebEx to an end. We will update our data from our website once again in 4 months, so late August. with a web conference in early September to review those most recent updates. We do also provide updates in the American Journal of Kidney Diseases after each of our Docs Practice Monitor updates, where we focus on an area of particular interest. And in fact, in the process of publication, or just e-published, is the material that Dr. Bozzoni just presented with respect to vascular access. Okay, well, thanks again for joining us, and have a good afternoon. Bye-bye.